morning everyone. I hope all of you are doing well. I'm Dr. Nidhi and I shall be talking briefly about microtropia followed by various tests used in its evaluation. So in whom do we suspect microtropia? A patient with unexplained mild reduction in visual acuity in one of the eyes, usually less than 20/30. When you do an examination, there is no RAPD, the color vision is normal. Fundus evaluation is essentially normal unless and until the patient has a central macular pathology. You do an HVF that comes out to be normal. You do an OCT that comes out to be normal. Moving on, there are various tests that we can do for evaluation of microtropia. Let's begin with Worth 4-dot test. This test is performed by placing red filter and green filter over the right and the left eye respectively in bright light conditions. It should be performed for both near and distance. A normal response would be to see all the 4 dots. But in a patient with microtropia, when the test is done for distance, then the angle subtended by the image would be 1.25 degree at the fovea. So in one eye, the image will fall within the central suppression scotoma and patient will report seeing images only from the other eye. When the same test is performed for near, the angle subtended at the fovea is 6 degrees, which is very well outside the scotoma. Hence, a patient will report seeing all 4 dots.
दिख रहे हैं, 2 नहीं दिख रहे हैं. इसमें भी 2 ही दिख रहे हैं, 2 ना के बराबर हैं. अभी तो 4 दिख रहे हैं.
Moving on to Bergolini's striated lens test, it is performed by placing a polarized lens in front of each eye. So one lens is placed at 45 degree and the other at 135 degree. Fixation target is a pen torch and patient is asked to indicate the direction of lines seen through each eye individually and then with both eyes together. Patient with binocular single vision will report seeing a cross with no intervening gap, whereas a central gap will be present in one of the lines in a patient with microtropia.
कंटिन्यूअस है कि
ऐसे है बीच में ये जो जोड़ होती है वहां से कट.
In a patient with BSV, placing a 4PD pace-out prism over the right eye, for example, will cause image to shift temporal to the fovea in that eye. Now to bring back foveolar fixation, this eye will rotate towards the apex of the prism. As per Hering's law, the left eye will also move in the same direction, causing image in the left eye to shift temporal to its fovea. This temporal shift of image in the left eye will induce a vergence movement only in the left eye to bring that image back onto its fovea. Now let's place the prism over the normal eye in a patient with microtropia. The initial version response will be same like in a patient with BSV, but the image falls within the suppression scotoma of the left eye, causing this image shift to go unnoticed, and hence the compensatory vergence movement will not be there. If you go ahead and place the prism over the left eye, that is the eye with microtropia, the image shift of the fovea will go undetected because it lies within the scotoma. Therefore, there will be no induced version or vergence movement of either eye. Next comes evaluation of stereopsis, which can be done with Randot stereo test using Polaroid glasses. Now here the patient identifies 3D circle in each line and the value of stereopsis against the given line is mentioned at the back of the book. Lastly, for assessing eccentric fixation, graticule present in a direct ophthalmoscope is projected onto the macula of each eye separately while asking the patient to look into the central small circle. This point is normally the fovea in a patient with BSV. However, in microtropia, the macular point that takes up this fixation can be parafoveolar. This is how a complete clinical evaluation of microtropia is done.